Welcome to the AOA Future in Orthopedic Surgery podcast series. This AOA podcast series will focus on the future in orthopedic surgery and the impact on leaders in our profession. These podcasts will focus on the vast spectrum of change that will occur as the future reveals. We will consider changes as they occur in the domains of culture, employment, technology, scope of practice, compensation, and other areas. My name is Doug Lundy, host for this podcast series. Joining us today is Dr. Roman Hayda. Dr. Hayda is the Chief of Orthopaedic Trauma at Rhode Island Hospital and Professor of Orthopedics at the Warren Alpert Medical School of Brown University. His areas of expertise include evaluation and treatment of fractures and other injuries of the extremities and pelvis. He also has significant experience using circular fixators and other techniques in distraction osteogenesis. Dr. Hayda gained experience in the U.S. Army, ultimately retiring as a colonel after 24 years of service. He served as the Chief of Orthopedic Trauma at Brooke Army Medical Center from 1998 to 2008, caring for wounded and injured servicemen and their families. In addition to reconstructing complex injuries, he was also integrally involved in developing protocols and techniques of amputation. He directed a number of research projects directly aimed at improving the ability to protect, evaluate, and treat soldiers serving on the battlefield. While there, he additionally served as an educator, culminating as the orthopedic surgery program director. He did his undergraduate work at Johns Hopkins University, went to medical school at the Uniformed Services University in Bethesda, and then did his residency at the Walter Reed National Medical Center. Then he did his fellowship in orthopedic trauma surgery with Dr. Chris Bourne at the University of Pennsylvania. He served on committees of the American Academy of Orthopedic Surgery, the Orthopedic Trauma Association, the American Orthopedic Association, and the Society of Military Orthopedic Surgeons. Dr. Hayda, sir, welcome to the podcast.
Thank you for inviting me. I look forward to this conversation.
Thanks, Roman. And as y'all probably have been able to tell, Dr. Hayda and I have recently returned from a trip to Ukraine, where he has a fascinating and a very interesting perspective on medical missions, working as a civilian in combat arenas and places with injured soldiers in foreign environments. Very fascinating story. I had an absolute pleasure working with Roman for over a week in Dnipro, Ukraine. And if I mispronounce that, I'm sure he'll say it correctly. So Roman, tell us about your story. Tell us about how you grew up and your Ukrainian background, because you were a very important person to have there because you speak the language.
Or at least I fake it well. No, Ukrainian was my first language. My parents were born in Ukraine and then were displaced persons. So when they were children, they had the direct experience of what war is like when Germany and the Soviet Union were fighting in the lands where they grew up. And then after the war, it was very clear that staying under the Soviets was not a tenable option. So they were able to emigrate to the United States after spending some time in displaced persons camps in Germany. In any case, I have Ukrainian roots, and we grew up in those kind of environs, but certainly I felt that as a U.S. citizen, it's important to serve our government that was able to protect our family. And so I went to college. I was in ROTC. And then I felt that the best way forward would be to continue a career in the military, and USUS would be the best way to do that. And that was a time of peace. But lo and behold, when I was a resident, Desert Storm occurred, and I had thoughts of becoming a sports guy, but war surgery became my calling. I was seeing those wounded soldiers coming back from Desert Storm. I felt that trauma needs to be something that is really plussed up in the military, and just to serve, that would be like the main mission. And so did that training in trauma after residency in 97, 98. And, we'll see what happens. And we took care of soldiers with severe injuries, but we didn't have many wars until 9/11. And then we really saw the consequences of that and saw the need to have expertise in complex trauma care. And the training we get as civilians in that is useful, but the volume and complexity that you see in war is completely different. And so that experience is indelible. And certainly you can't help but learn. You see things from various different perspectives, and you see the complexity. You see these young folks with bad injuries, and you see them recover. And so that has a very important place in my heart and in my mind. And as war occurred in Ukraine, and I was already out of the Army at that point, it was just logical that I should be involved in that. And I started that involvement in 2014, going there a few times. That war, when that started, was relatively low level and static, but I did a couple missions in 14 and 15. And then
That was in the Crimean Peninsula, right?
That's when the Crimean Peninsula was annexed with a fake vote. And in the Donbass, in the eastern part of Ukraine, there are quasi-military people, but they're clearly supported by the Russian military. But there was basically a static line established by 2015, 2016, and that persisted till 2022. When the full-scale invasion, then that's a totally different scale of war. And I looked at ways, and there was a lot of people doing lots of great things then, but looking at ways to engage my skills as a Army surgeon, engage my knowledge of Ukraine, and provide help for these casualties. And so since that time, I've been now 8 times since 22. So if you count all the times, it's now 10 or 11 times.
Wow, yeah.
On medical mission.
Let me back up a skosh here. So in many ways, you are the definition of a true red-blooded American in that you grew up in a Ukrainian household. You said your first language is Ukraine. What the folks may not know is, as you were telling me, and we spent a lot of time together in that time that we were over there, that you went to Ukrainian school where you learned Ukrainian customs. You married a woman who also is Ukrainian, speaks Ukrainian, yet even embracing all this Ukrainian heritage. To your point, you felt the obligation and the personal demand to serve the country that you are a citizen of. You're a proud American, and you went to Bethesda and served as a U.S. Army officer up all the way up through the rank of colonel to serve in our Army for that. So can you tell a little bit more about the Ukrainian school and how you met your wife, your relationship with her in terms of her basically endorsing or encouraging your trips overseas like this?
Yeah, it certainly gave her a lot of insight into what I was thinking. My parents, as I said, knew what living under the Soviets was like, particularly my dad. It was a terrible thing. And growing up in the United States, hearing these stories, there's no question at all about which system makes sense, which system values humanity and human values. And it was not a big deal in those times I thought we owe a lot to the way the US system is set up. And so it was very easy for me to forego some of the advantages of civilian practice to serve in the system that allowed my family to continue to survive, because that would not have been the case if they stayed in Ukraine, which was part of the Soviet Union. And for that, I'm forever grateful. And so it's a really important thing to engage, and for people with values to serve in our government, because it should reflect our society. And so when the Ukrainian people said, we're not going to stand for Russia impinging on our Now, that whole scenario started because the elected president, who was supported covertly by Russia, reneged on his agreement to turn towards Europe, and he turned back towards Russia. And so that is what started the whole Maidan movement, the protests in their central square. And so we were watching that intently because it was something very important to us. And they fought for their freedom. So as an American, I felt that reflects our values. And with my skills, I have certainly something to offer. And I felt it very important to do what I can and continue to do so.
Yes, thank you. So we went to Dnipro. I'm pronouncing that correctly.
Dnipro, if you want the official, but that works. Everybody understands.
Let's do it your way. So we get there, and to your point, the Ukrainians have been at war for 4 years. So in many ways, they were living life. They have to live life. They can't just go on hold and put everything in and just go into bomb shelters and just hope for the best for 4 years. They have to get out and go grocery shopping and go to church and be married and have children and send their kids to school. On the other hand, they're under constant threat of drone attack and missile launches and air raids all this time, plus the incredible insurgence of wounded soldiers that are coming in medevac all the time into the hospitals that we worked at. So you said this was your 8th time in this war, in the 4 years of this war that you came in there. What particularly takes you where we were in terms of the culture, the ability to, the ironies that we ran into in terms of the Ukrainian people and the fact that there was a full-blown war going on, but in some ways it almost seemed like normal society in a very strange context.
Yeah. The first time I was in Dnipro, I was sponsored by a Jewish group, the Kalila Project out of Boston. And that was in 2015. But to help take care of war wounded, to help exchange ideas and knowledge. And I met some people there that were just wonderful people. And my family in Ukraine is in the western parts. This is South Central. I had never been to that part, but it actually under the Soviets, it was a closed city. You couldn't travel there even if you wanted to. In any case, those friendships continued. And, when the full-scale invasion happened 8 years later in 22, then we started thinking about what else I can do. And there's been a number of times, and that was, I think, the second time I went. And there, I felt that same thing, that here we are close to the front. There's a huge need. There's people who are willing to learn and are working extraordinarily hard. And how could you not support them? And so this was the third time I've been to Dnipro. And because I knew those people, worked at different hospitals. The Mechnikov is the biggest trauma center in Ukraine. And because it is very close to the front, they had to expand. You remember what they said? They said their ICU went from 40 beds to 140 with people still in the hallways because there's a compelling need. And that's just kind of people flowing through that, because they have to, as being close to the front, they're 60 miles from the front. They get immediate evacuations. They have to be able to take care of it, temporize them, stabilize them, and then move them on. That's echelon care. And the military, wherever you are, that's what they practice. But when you talk about the scale of the war, okay, this is completely different than Desert Storm, completely different than OIF or OEF. This is on the scale of World War II. You hear the news reports, they talk about this is the largest land war in Europe since World War II. And in some ways, the casualties are greater. if you look at
Yeah.
that.
So we looked at that, and the U.S. has reported 6,700 deaths since the war on terror began in 2001 in the U.S. 6,700 deaths in U.S. service members. In comparison, how many Ukrainians have been killed?
Last I looked, about 6 or 9 months ago, these are not numbers that are readily available. They don't publish them. But
Right.
Zelensky, the president, came out and said that there were either 30 or 50,000. And if you look at all these cities, they have cemeteries where they have fresh graves and flags and all that. They also, we did not see it in Dnipro, but there are certain places in every city where each city memorializes the people that were killed in the war. And I have pictures from Ternopil and Kiev, Lviv that show just that. And it's just picture after picture from all parts of Ukraine. But these are for those, and particularly to that city.
Now, one thing that struck us both, well, struck me, I was in the Army as well, not to the level you were, of course, that the combat in Ukraine is extremely unique, whereas in the U.S. wars in Afghanistan and Iraq, we had air parity, air superiority, and we could fly into combat areas and evacuate our wounded soldiers. Not the case in Ukraine. Can you explain to folks the additional challenges that face the wounded soldier on the front in Ukraine as compared to perhaps the war in Afghanistan or Iraq?
Yeah, the military terms that they use for this is a near peer or LISCO war, where there is not air superiority. And what's also different here is not only can you not evacuate by helicopter because that helicopter would get shot down, but in addition to that, we've gone into the next phase, the 21st century. You have drones. What was true 2 years ago is no longer true now. It has evolved. That evolution is much quicker than what I experienced in taking care of U.S. war casualties. It's probably different than what occurred during World War II, but at this in 22, 23, you still had the ability to evacuate people by ground and a few by helicopter. That is no longer true. Because there's no air superiority, you can't evacuate by helicopter. But what's different now with the drones is you can't even evacuate by land, because what occurs is those drones are surveilling. And I was talking to some medics, and they were saying that you can't square this math. If you send 3 or 4 medics in to rescue somebody, and they do rescue that person, but you lose 2, that math doesn't work. And so they've advanced to drone evacuation on ground platforms that they figure out how to load them onto that platform. And then this 4-wheeled or whatever tracked vehicle with the patient on it, but no other personnel, can get out of the zone of those drones. So the kill zone, from what I read now, is on the zone area like 20, 30 miles. That, you just can't walk around because drones are surveilling everything. And that's very different than what we experienced in Afghanistan and Iraq. Very different than World War II.
Can you tell folks about the types of injuries that we treated both at Meshkov and at the Institute?
Yeah, so the injuries themselves are very similar to war injuries. In this case, many of them are caused by drones, but what do drones do? They drop explosives. And there are gunshot wounds too, but explosives, whether they're mines or artillery shells, what have you, the explosive munition causes a high energy, very close, highly contaminated wound with complex fractures and multiple tissues that are injured, not just bone, but ligaments and muscle and skin and nerves and vessels. And a lot of them, in order to survive, you have a severe mangled limb and you don't know when you're going to be evacuated. That golden hour is gone. You're instructed to put on a tourniquet. And they may need to keep that tourniquet on, not just for an hour or two. It could be a day. And there are even reports of folks having tourniquets waiting evacuation for 7 days. And obviously those go on to amputation. That's a whole nother discussion about which persons should have tourniquets and which should not and so forth. But if it gives you a potential for survival in a severe injury in a very isolated environment, well, that may be something that you do. It's hard. And with the winter, we saw a lot of frostbite injuries too.
Right. So let's talk a little bit about leadership in this, and let me paint the picture. So when we get there, these are highly competent, motivated, exhausted, but highly competent and motivated orthopedic surgeons who have been taking care of war injuries for 4 years now. These are not people that don't know what they're doing. They're quite skilled. And then we show up, discuss some of the leadership techniques and mentality that you use when you're walking into an environment like this, where you're trying to help, you've got additional skill that you can teach things. Yet these are very proud and independent people who are competent in doing their own thing in the midst of an extremely stressful and trying time. It really takes a strong character and leadership in order to excel in that domain. And you've been doing it a number of times. Walk us through that.
Yeah, that's a really good question. I'd be interested to hear your perspective because of you needing to work through a translator. But for me,
Yeah, that's true.
speaking Ukrainian, I get that trust right away. And to an extent, I'm a known entity among orthopedic circles in Ukraine. So that helps. But I think fundamentally, I didn't get there overnight. I think it's always about showing respect, listening well, giving suggestions. And the other part of it is really fundamentally true. And this is one of the things I always learn when I go in these environments is you have to learn to be flexible and adapt. If you expect those same conditions and the same equipment that you have back home, that's not going to happen. And you'll be just blowing your top. And that's not going to help anyone. You might as well go home. But, if you watch these guys do what they do with what they have, it's amazing. Now, I think the other part, and we talked about this a little bit, is if you think about where they were 4 years ago, where they were 10 years ago, orthopedic residency in Ukraine is 2 years. 2 years. Imagine yourself if you, after 2 years, say, okay, you're an orthopedic surgeon, take care of this really bad injury. Not only that, but when you train, you don't have free access to all kinds of courses and all kinds of equipment and all those things. It's amazing to me that some of those surgeons are as incredible as they are with those handicaps, but that's because they're dedicated surgeons. And so, yes, I always feel that we have things to learn, but we also have things that we can teach, and making that a two-way street is really what helps everybody. And there's certainly no one that I know of that has seen everything, knows everything, and can take care of everything.
Right, exactly. So if folks were going to embark on something like this and try to get involved, and you've given some very good pearls of attitudes and mindset to go in with, what other principles or leadership thoughts would you give people if they were saying, I need to get involved? And it's not necessarily just in Ukraine, but in any developing world setting. I want to really make sure I point out that Ukraine is not necessarily the developing world. It's a very modern and industrial country that has tremendous amount of assets. Unfortunately, those assets have been stretched to the edges with the tremendous number of injuries that they've had to take care of. And it's not, to some degree, it's certainly not a developing world area. But for folks that were encouraged in doing things like that, what would you tell them that they should think about or prepare for?
Yeah, every one of these situations is a little different. And every time I go to Ukraine, it's a little different. You see slightly different injuries. If you go to different hospitals, their setup is slightly different. And what helps a lot is doing some research ahead of time, getting some intel, if you will, understanding kind of the culture, the history, the traditions. And maybe if you can learn a few phrases, that goes a long way to opening doors. The nice words, Doug. Yeah.
I
Uh,
tried. It was
yeah,
tough.
you did. You're absolutely, those
Humble.
things will open hearts and open minds. And that's really valuable. And I think by far the most critical thing is to go in with not a sense of you're going to show everything and do everything, but that it's going to be a two-way exchange. And if you have that intel, you can figure out what are the things maybe you can help them with, and what are the things you may be able to learn from them, because they'll be more than happy to teach. I mean, you had that great experience with Andre with Elizabeth.
Right. Yeah, to catch people up with what you're saying, we had a rather stern, let's describe him that way, older orthopedic surgeon that I think to some degree he may have been humoring us. And you and I both have done a lot of LSRF work over the years, and this guy was putting wires in like I've never seen anybody do before. I mean, he was obviously an incredible master. And when he realized that we appreciated that, I appreciated his expertise and his incredible skill, all of a sudden hearts melted. And if you recall, me and him were BFFs, even though we couldn't understand a word either one was saying. But yeah, I was on the learning side on that one. That was something else. So the future for Ukraine, let's suppose this, unfortunately, this would not happen, but let's suppose that the war ended today. The work there will survive you and me, will probably survive any orthopedic surgeon listening to this podcast, because the wounded soldiers there will require care for decades. You want to talk about a little bit about let's suppose the war was over, we're now in a peacetime. The demand and the need there just surpasses anything we can fathom.
Yeah. First off, just war injury care doesn't occur in 2 months, 3 months, or 6 months. You just think of your severe trauma patients. Those are easily 6 months, a year that you're following up. And those are by number and by complexity on the simpler side. If they have an infection, if they have a contracture, if they have a nerve injury, if they're an amputee and they're having problems, as you know, those are things that will need continuing care. And a lot of care in Ukraine with these complex injuries, given their limited resources, a lot of it is treated with external fixator as a definitive treatment, or they show up late to the centers that are capable of doing complex internal fixation and so forth. But they come with contractions. And how do you solve that? I routinely get calls and consultations on folks, this guy is 2 years out from his injury and he has this problem. What do you do? And so that's going to continue. And I can also say, just from my U.S. military experience, there's a guy that I took care of as a resident, first year resident, great guy. And that's actually, in my mind, he compelled me to go into orthopedic trauma. But years later, he had developed this chronic draining fistula that went on to a marginal ulcer. Recognizing that and taking care of it was extremely important. He got it taken care of, and he's doing incredible things still. And so that will be the specter that will continue to exist in Ukraine for a long time.
So I can hear folks thinking, all right, so you're the ultimate triple threat. You speak Ukrainian, you're an ex-Army officer, And you're a fellowship trained orthopedic trauma surgeon. So you have an ability to contribute that very, very few people would. So for the average orthopedic surgeon out there who wants the help that doesn't have that skill set, what would you advise them in terms of both helping within the Ukrainian space or any space in the part of the world that has need?
Yeah. Some of the stuff that I feel that my presence there and your presence there is not the technical expertise that we shared, but the fact that we were just merely present to share the burden, to show that we care and understand, that is a tremendous uplift. If you think about it, as you said, there's been a very big active war for 4 years. Okay. Many of those families, they are divided where their spouses and their kids may be in another city. They may be in another country. Even if they're at home, when you were in Dnipro, what did they say? We have power for 4 hours and are at home. The hospitals they have all the electricity they need, but they're working under those conditions day in, day out. They don't know how many patients are going to come in on any given day. They know that they're dedicated and will take care of them. And so if we can offer a slight respite to that, that's a win. And I think we for sure got that. We got some other benefits as well, but we for sure got that. But getting back to your other question, what else can you do? Well, it's any range of things. And talking to your congressman, collecting used equipment, external fixtures, tailor spatial frames, those kind of things. That is being reused in Ukraine. You can donate money to any number of NGOs that are very active in that space. And you can pick what is it that you want to do, whether it's strictly medical or humanitarian or military. All those things exist and all those things are meaningful. I think it'd be wrong to think that the only way you can contribute is by going there and putting your hands in. Well, it's not for everybody, for one. And if you do decide to go, yes, I think it's possible. But I would encourage you to go with a group. There are a number of different groups that go. They do need help, and it is possible to do that. But it's not something you can just hop on a plane, because first off, you can't fly into Ukraine right now, but you can get to the border and go in that way. And there's various ways to help. My wife has volunteered in basically a kitchen that freeze dries food for soldiers in Kiev. And so it's a great group of folks, and there's those kind of things. So there's any number of ways you could do it. I think expressing that support in whatever way works for you is meaningful and really appreciated. They're working hard.
Right. Under very severe circumstances. Now, I'm pretty sure you remember that very first morning after we were there, the evening before, you and I met for breakfast, and we discussed about some of the events of the night before, because we were in an active war zone. Do you want to tell folks what we experienced?
Well, Doug, you are the very astute and prepared infantry officer. I was the jet-lagged medical person. And so you heard the air raid siren. I didn't hear it. But there was an air raid siren that went off that very first night. And later, and you saw and heard the booms. They were a few miles away. So that certainly for you was a reminder that, yeah, this is the war zone. This is not something to be trifled with. It is not for anyone. You have to understand that there is risk with that. As you and I talked about, this is not a place where I would ever consider taking a resident or a fellow. If they end up there on their own, that's their problem, their issue. But it requires a certain commitment, if you will, but you have to assess the risk, and it's not for everybody. And I would not recommend it. I feel a compelling need, and I really appreciate the fact that you felt similarly. But unless you go into that with eyes wide open, you're going to turn around and walk away. And we did hear, remember, from the director, the orthopedic chief at Metchnikoff, that they've had a few volunteer groups that came in and turned around and walked out when they heard how close the war was. And those are decisions you make.
That was obviously very true. And we did have those intermediate range ballistic missiles that came over the hotel. And I was jet lagging. So I was wide awake at 2 a.m. It wasn't that I was exceptionally aware. I was just awake anyway. And the drones, we did also hear the drones flying around as well, which obviously you stay inside, you stay covered when you hear those things. However, at the same time, one of the things that just astonished me is folks are living their lives. So yeah, we went in there with the eyes wide open. Yes, we were in an active combat zone. Yes, our safety was in peril. But at the same time, there are folks that lived there. They lived there for the last 4 years under this incredible threat and just suck it up and keep going.
Yeah, that's true. And I think that can be said of a lot of humanitarian missions, depending on where you go. That is one of those intel things you look for before you go in, to know what are the threats. It could be bombs, it could be gunshots, it could be various diseases. Is the water safe to drink? And so knowing that will keep you safer and more effective.
And when somebody goes, that's the craziest thing I've ever heard, bless you for going, but why would you put yourself in harm's way? What would you say for that? Why would you risk your life or your safety for something like that?
Yeah. Well, these folks are doing it every day. And for me, yeah, it's my background that compels me, for not only as being of Ukrainian heritage, but my military background, knowing that, yeah, I can't stand if a soldier who's doing their job for whatever country that is, they're injured and they can't get the best possible care. That hurts me as a soldier. And I think they deserve the best that they can get. And these guys are working extremely hard at their job, putting their lives at much, much, much more risk than I have.
Very well said. Thank you. All right. It has been an absolute honor and pleasure to discuss this incredible experience and the ability to really serve at the top of our profession at the most important things that we have as orthopedic surgeons with my friend and colleague, Dr. Rowan Hayda. And Rowan, I want to publicly thank you once again for your incredible guidance during this probably without question, one of the most salient, important moments of my entire life as an orthopedic surgeon. And I thought it was important to share this with everybody. So thank you for being on the podcast, sir.
Thank you. Appreciate it.
All right. Y'all join us again for other episodes in this podcast series.